In this video, we will look at the crucial symptoms of colon cancer that should not be ignored. We will answer the following questions. How do you know if you have colon cancer? What are the early symptoms of colon cancer? What are the symptoms that indicate late stages of the disease? How do you detect the disease at an early stage? What are polyps in the colon, and how can you prevent them from developing into cancer? Why is the incidence of colon cancer particularly high and affecting not only the elderly but also increasingly younger people? Today, we will look at this alarming trend and begin a serious discussion. Be sure to watch to the end, because at the end, there will be a list of the most common colon cancer symptoms you may encounter, and most importantly, are there natural ways to prevent and fight this disease? So, if you want to become a master of your health, click like, and let's get started. Colon cancer is among the most devastating diseases today. It is the third most common and second most deadly type of cancer. But what makes the fight against this disease even more challenging is the huge industry created around it. An industry driven by money, misleading advertising, and information so confusing that both patients and healthcare providers are often misled. A common misconception is that the risk of getting colon cancer is largely determined by genetics. While it's true that family history can increase risk and accounts for 5 to 10% of cases, it's far from the whole picture. Genes may load the gun, but it is our lifestyle that pulls the trigger. Because of this, modern research is increasingly emphasizing the importance of diet and lifestyle as key factors in preventing or even reversing disease. For example, foods rich in antioxidants are now recognized for their role in combating various chronic diseases. This is not just speculation. It is a rapidly growing area of scientific research that shows where medicine is headed in the future. Now let's look at the main questions we talked about at the beginning of the video. Namely, how do you know if you have colon cancer? What are the early symptoms of colon cancer? What are the symptoms that indicate late stages of the disease? How to detect the disease at an early stage? What is a colonoscopy and who should perform it? What are polyps in the intestine? And how to prevent their degeneration into cancer? And most importantly, are there natural ways to prevent and combat this disease? Contrary to popular belief, this type of cancer often goes undetected for a long time, sometimes even years. It usually starts as a small, slow-growing polyp on the wall of our intestines. At first, it takes up minimal space and does not interfere with the contents of the bowel, so in the early stages there are no symptoms. This is why colonoscopy is recommended for those at high risk, especially those over the age of 45 or 50. The recommendation comes even earlier if you have close relatives suffering from cancer. Colonoscopy can be used to visualize, detect, and remove polyps. The appearance of symptoms often depends on both the size and location of the tumor. Interestingly, colon cancer that develops in the right side of the colon can be more difficult to detect. This is because in this case, the feces are still liquid and the intestine has not yet absorbed all the water that passes through it. So it is difficult for the tumor to block the intestine at this stage unless it is very advanced or has metastasized to other organs such as the liver, bones, or lungs. Let me give some tips for early detection. Tips for early detection. Tumors often grow haphazardly, which leads to bleeding. The problem is that this bleeding is not visible. One method of early detection is to analyze the stool for hidden blood. This involves taking a stool sample and sending it to a lab for analysis. Colonoscopy is also effective for early detection, but pay attention to these warning signs. Chronic bleeding can lead to iron deficiency anemia. If you are around 45 or 50 years old and look paler than usual combined with iron deficiency anemia, you should be screened for a tumor in your intestines. Sometimes the feces may look darker due to a slight increase in bleeding. Now consider colon cancer, which occurs on the left side of the bowel. Bowel obstruction or blockage occurs earlier here because the feces are already hard and have less water in them than on the right side. So, what symptoms can a person experience? Before we look at the following colon cancer symptoms, don't forget to subscribe to our channel and turn on notifications to stay up to date with our informative videos. One common symptom is a change in bowel habit. Let's assume that your normal routine involves going to the bathroom every day or every 2 to 3 days. If you notice that your constipation has become more frequent recently, and you haven't had a stool for 1 or 2 weeks, this should raise suspicion. In other cases, the shape of your stools may change. They may become thinner as they pass through this area of the bowel. Otherwise, bouts of diarrhea may alternate with periods of constipation. Many people suffer from chronic diarrhea, which causes doctors to consider performing a colonoscopy to check for a tumor in the intestines. When a tumor grows to an advanced stage, it creates an image on an X-ray that resembles a bitten apple. Specifically, this image shows the narrowing of the intestinal lumen due to the tumor. As a result, feces has difficulty passing through this narrow area, and the tumor can also cause bleeding. Unlike hidden bleeding in the early stages, here the blood is often bright red and visible. Because of the presence of blood, feces may appear darker, as in colon cancer on the right side. Other symptoms that indicate later stages of cancer include abdominal pain from gas due to obstruction, abdominal bloating, weight loss, fatigue, and chronic fatigue. Symptoms can also occur in internal organs, such as liver pain due to metastasis or shortness of breath if the lungs are affected. Therefore, the information below on how to detect this disease at an early stage, and more importantly, how to prevent it naturally, is crucial. What are intestinal polyps? Essentially, they are benign small tumors that hang like appendages from the walls of our intestines and usually do not show any symptoms. The most effective way to detect them is through a colonoscopy. This procedure not only allows us to visualize the polyp, but also to remove it and send it to the laboratory for analysis to determine whether it is benign or malignant. However, there is a catch. A small percentage of these benign polyps can turn into cancer over time. And this is where we come to the main point of this video. What factors influence this transformation? As mentioned in the beginning, it's a combination of our genetics and lifestyle. Contrary to previous beliefs, our genes are not something immutable. How do you prevent colon cancer? The best way to prevent colon cancer, as current research shows, is to make sure that our food choices, from supermarket selection to preparation, play a crucial role in our health. A balanced diet, along with other healthy habits, can have a real impact on gene expression. Specifically, genes associated with chronic inflammation, dementia, obesity, heart attack, and cancer may become less active if we make healthier choices. On the other hand, poor diet and bad habits can accelerate the activity of these same genes. Simply put, it can accelerate the growth of a polyp and its subsequent transformation into a tumor over time. Risk factors for colon cancer are what accelerates a polyp to turn into cancer. Several factors contribute to this, such as ultra-processed foods, excessive consumption of red meat, especially its more processed forms such as sausages, salami, ham, unhealthy fats, excess vegetable oils except olive oil and some others, sugar, excess sodium. These foods, especially if they come from ultra-processed foods, are like adding fuel to the fire for tumor growth. Ultra-processed foods have long been officially recognized as carcinogenic. Other contributing factors are constipation, poor or insufficient gut flora, microbiota, and chronic inflammation. In addition, habits such as alcohol consumption and smoking are also known to be carcinogenic. Foods and habits to prevent colon cancer. To reduce the risk of developing colon cancer, it is recommended to follow a diet rich in anti-inflammatory and antioxidant foods. These include fruits and vegetables of different colors consumed daily. Spices such as turmeric also have excellent anti-inflammatory and antioxidant properties. Consuming healthy omega-3 fats found in fish such as salmon, tuna, sardines, and anchovies, or plant sources such as chia seeds, flax seeds, and sesame seeds is also recommended. Avocados and eggs from free-range chickens are also good sources of healthy fats. Controlling constipation is another way to reduce your risk of cancer. Consuming enough water and fiber can help with this, as well as improve your gut microflora. Other healthy habits that are often overlooked include healthy sleep, exercise, and increased social interaction, all of which have antioxidant and anti-inflammatory effects. Foods such as nuts and seeds, including pumpkin seeds, are also good for gut health. Now let's talk about diverticula and diverticulitis. You may be wondering if you can consume seeds, nuts, and hard shells of some seeds and nuts if you have these conditions. The answer is yes. Contrary to popular belief, a study involving more than 47,000 patients found that eating these foods does not increase the risk of developing diverticulitis or its complications, such as bleeding. As a result, patients with diverticulitis are no longer advised to avoid these foods. On the contrary, these foods may improve the microflora and function of the intestines and may even help prevent the development of colon cancer. However, each case should be considered individually, so consult your doctor if you have bowel problem. More information on this topic can be found at the links in the description below this video and on our channel. Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.